Thank you for joining us. Today, we're here with Christine VanZandenbergen, the Vice President of Information Services Applications at Penn Medicine in Philadelphia. And we're going to talk about work done at Penn Medicine to improve efficiency of genetic testing using the electronic health record system. Welcome, Christine. Before we get into talking about that, could you give a little background about yourself and your role at Penn Medicine?
Absolutely. Thanks so much, David, and really just a pleasure to be here. As you said, my name's Christine VanZandenbergen, and I was Vice President for Applications and recently actually transitioned to a role that's now got oversight for analytics and research at Penn, and have spent almost 20 years at Penn. From a background perspective, I'm clinical, so I'm a physician assistant, and so I think I bring a little unique lens to the technology aspects of the work that we do. And Penn Medicine's a large academic located geographically in Philadelphia and the surrounding area, 6 hospitals, 200 to 300 ambulatory practice sites, and deal with a really diverse patient population. So very much embedded within our communities in and around Philadelphia, and then also, geographic areas more located in the suburbs. I started my career at Penn as a PA in cardiac surgery and somehow fell into IT along the way. But really excited to be here to talk to you all about genomics and how we're leveraging it to provide precise care to our patients.
Great. Well, before we get into talking about some of the innovative work that Penn Medicine's done, could you describe some of the challenges that all health systems face in ordering genetic tests and getting results back? Is it that it's usually unstructured data in like PDF format, and why is that a problem for health systems?
Yeah, I think if we think about the challenges with genomics and technology today, there's 2 big buckets, at least from my lens. One are the systemic healthcare challenges around genomics and adoption of genomic medicine and how do we actually impact care. And then the second is really the technical challenges. So if I start with the first and I think about, what are the systemic challenges that we continue to face in genomics, it's really still around the payer models and reimbursement, and that's gotten better, which is good, but still has got some way to go. Second really is around education and the education of the clinical community and where it can truly impact care, but also our patients. And what does all this actually mean when they get a result back? And then the third thing is just this consumerism type of environment in healthcare and specific to genomics, how that's accelerated over the last couple of years. And as healthcare, we've got to figure out how to accommodate for all of that. That coupled with the technical challenges, which, to your point, David, around PDFs and the ability to capture discrete data versus non-discrete data and make it actionable, has been a real challenge, and one that I know we're going to get into a little bit further in how we approached it. And then, the additional technology challenges that our core EHR vendors have around, even if we could get it in a discrete manner, how can we store it and then make it actionable? Not all vendors, have gotten there yet. So that was certainly a challenge. And then the external labs and their technical capabilities to actually send us data in a way that's discrete and usable.
And so the EHR is kind of the focal point of this effort, right?
Yeah, for us, it has to be, and that's because that's where care is delivered. And so for us, making sure that information could be delivered to the clinicians taking care of the patients at the point of care and to patients so that they've got their own data were 2 core, components of how we approached our challenges.
So I understand your IT team created a precision medicine tab in the Epic EHR. What are some of the steps involved in creating this genomic medicine-friendly EHR? Were there challenges in making sure it fits with the clinical workflow?
Yeah, it's a great question. So one of the things we heard loud and clear from our clinicians was that'd be great if you could capture genomic data discretely, but it's going to get buried. And that means it's going to get filed along with everything else that is a result. And that was not going to provide enough value to our clinicians. And so when we stepped back, we said, okay, well, this isn't just about a result. It's actually about precision medicine. A fundamental piece of that was to create a landing spot for both the genomic results now, but then as we looked at the future, other pieces and parts that might be really important for people to see, such as, family history, and pedigrees and a whole slew of other pieces and parts. So we looked at our vendor and said, okay, what native capabilities do they have to create these semi-customized spaces? Epic is our core EHR vendor. And so we took their native functionality and then adapted it to to house genomic data so it could display that discreetly, but then also be able to display the PDF documents, because it had some flexibility for us to do that, so that there's a landing spot for our clinicians to go that consolidates that information.
So could you give our viewers a sense of the timeline of the Penn Medicine Genomics module implementation, and who needs to be involved in pulling it together?
Yeah. So I think for everyone, there's a couple of key pieces to that. One is your vendor's readiness. So when we started this journey, and it was probably about 18 months or so ago, our vendor had some of the core pieces and parts ready, but not all of them. And so they partnered with us and our clinicians to say, okay, specific to genomics and variants, how do these things need to be labeled and what needs to be changed? And to their credit, they responded to us and other customers that thought that was necessary and made those changes. The second piece is, from a clinical perspective, your genetic counselors and your physicians that work in this space are critical to this effort in terms of what's necessary and meaningful. And so we were fortunate that we had clinical champions that were engaged from the get-go in this, a project manager that could really organize all of us around it, and then strong technical resources that could execute on the technology stack and make sure that what we had solutioned and built was both usable but sustainable over time. So I think those pieces are absolutely critical. And our first stage was to make sure the core capabilities within our EHR could function the way we thought, with our partners internally, identify the dependencies that we needed from our core EHR vendor and then our external vendor partners to actually send us the results back, and then deploy the solutions as we thought would make the most sense. And we did it within a small area first, with a small group of users, so that we could understand what worked about it and what didn't. Most solutions, the first time you deploy, you hit a lot right, but there's always something you didn't think about. Sure. So that gave us time to really adapt before we sent it out more broadly.
So can you describe a little bit of what it looks like from a clinician standpoint in terms of this streamlined ordering of genetic tests and receipt of results? And is there clinical decision support built into it for clinicians to discuss variants or an addition of patient-facing materials?
Yeah, so we took the approach that, ordering is ordering. And, our clinicians order all kinds of things. And there's a few things that are important in that. One is that they know how to find it. So standardized nomenclature that they could use a search to find the right test was key. And again, our clinicians informed how to do that. Two is making sure that it was inserted into some of their standard workflows, whether they had preference lists or order panels. We developed it, again, much in the same way that they order all of their other studies, so that it felt integrated and wasn't like, oh, there's this new thing. It's just another piece of the way that we care for our patients. From a resulting perspective, again, genetics is a little bit different. And so those results we do handle a little bit different. One of the things that came up as we talked about the integration with our labs is there would be very little filtering capability, which for a standard CBC or a chemistry test is okay. It comes back and it files into the EHR. For genetic testing, what we found was, in the paper world, somebody actually held on to that result before they would scan it into the EHR. So there was a human filter that decided the point at which they wanted it exposed broadly in the EHR. When you've got an interface coming from a lab, it's all in there. So we had to get pretty creative about what to do with that. So the way we solved for that was to actually create a landing spot, a custom landing spot outside of our core EHR. That's called our results portal, where the genomic counselors can go in there, genetic counselors can go in there, look at the result, and then release it into Epic. So before it actually makes its way into Epic, somebody ensures that they've had a conversation with the patient, they understand the interpretation of that result, and then it flows into their electronic health record. And so for us, that was a key thing that we uncovered as part of the solutioning of this. The landing spot, again, the results file like any other result. So it goes to two places. It goes to the results, because it should always go there because it is a lab result. But then it also files into the precision medicine tab. So it's actually available in two spots.
So you mentioned a little bit about integration with the outside labs. Could you talk about how big of a lift that is and how many labs you've worked with?
Yeah, great question. So this was a bit unexpected. We had an assumption that they were much further along from a technical perspective than they were. So our selection in terms of the first company that we worked with, which was Ambry, was absolutely based on their technical capabilities to partner with us to send us results, both in the PDF format, but also as an HL7 transaction so that we could have those discrete results captured. So we started with one. We also started with PDFs because we thought, let's start, basic and then get more complex, and that worked well. They were a great partner. We've got a second lab that we've started doing both orders and results with, and that's in Vitae. And then we've got two more, OneOme and GeneDx, that will be coming up shortly in the next couple of weeks or so. So we started with a framework, which was, okay, choose your partner. That's a good partner and has the right technical capabilities. Start small, which is less technically complex. So orders and results are pretty easy from an ordering capabilities. Results back, easiest is PDF back. More complex is discrete results. And that's how we've approached the additional vendors. So the cycle with the vendors has gotten smaller because we've worked out, what we think is the most efficient way to approach it.
So what's the uptake been like amongst clinicians, and maybe some anecdotal feedback you hear from them?
So it's not often that I can say this, but the response from the clinicians has been overwhelmingly positive. Life-changing. This is amazing. I mean, these are real quotes from our clinical community, in that they can find the information for their patients and actually be efficient in their conversations and make quicker decisions and more appropriate decisions because we've been able to support this. I think they were surprised in some ways about how much it would actually change, their ability to care for the patients in the moment in an efficient way. But truly has been overwhelmingly positive, and one of the most remarkable advances that we've had, I think, from a configuration perspective. From a numbers perspective, we've got several hundred that use it regularly, which maybe doesn't sound like a huge number, but for us, from a genetic counselor perspective and a provider perspective, it's actually quite a large number relative to those who do that type of work.
Are there some other potential benefits to having discrete genetic results? Like, could it help identify patients who might benefit from new clinical trials, for instance?
I think the answer to that is 100% yes. The long-term value of this is not necessarily the variant that you get back that is significant today, but is potentially significant in the future. And I think we see tremendous value in that, which is why for us, some of the filtering capabilities we have accommodates for both. So today we're going to store and pass through the information that we know is of clinical significance. But in addition to that, also store the remaining information for potential future use, whether it's for clinical research or population evaluations and studying where opportunities are, disparities in care, a whole slew of those.
Great. Well, this has been fascinating. Any other lessons learned from this project or next steps in the journey you want to share?
Yeah, so lessons learned are it is invaluable to engage your clinical partners through the entire journey, in addition to your vendor partners. Without those two pieces, the road is long and likely to be unsuccessful. And so two pieces of advice are that truly find a clinician who's passionate. We've had unbelievable engagement, and still today, from our core clinical partner, Kate Nathanson, who is a forever champion of this work, and now can't say enough good things about us as technology partners. So institutionally, you gain a lot in that relationship, and for the patients, that piece in part. I think, future state is more of the same. It's getting these interfaces and interactions up with our external vendor partners in our labs. But then too, really thinking about the patient and how do we actively engage with them and make sure that the patient-facing pieces of this are interpretable. It's a confusing world for our patients. They've got all kinds of things coming at them, and individuals who have information about them and sometimes not the right interpretation. So I think getting that piece right is really important.
Great. Well, Christine, thank you so much for sharing about this initiative. It's fascinating.
Thank you so much.
Okay.